So today we are going to speak to a very precious colleague, to Steve Finn, Dr. Steve Finn. Hello, Steve. From Austin, Texas. He's the founder of Center of Therapeutic Assessment and a licensed clinical psychologist who practices in Austin, Texas. He's author of numerous books on therapeutic assessment and also has received numerous awards. You can see more of his bio on the website of the Center for Therapeutic Assessment. Steve, I wanted to talk to you because, as I've already told you, for me, when we go to a conference where we usually meet in some context at a Rorschach or some assessment conference, uh, coming to a therapeutic assessment part is always the most refreshing and most meaningful part for me. Uh, I came across your work years ago through your book, In Our Client's Shoes, and it really gave me some ways to think about how to engage clients in a way that makes sense and how to make assessment humane and really practically useful and believable. So I would really like you just to introduce us to what therapeutic assessment is and just to show us around a bit in your world of thinking about how assessment can go.
Oh, thank you, Mark. Yes, happy to do this. So wonderful. Well, so in brief, therapeutic assessment is a short-term intervention that uses psychological assessment at its core. And we use the same tests as are used traditionally in psychological assessment, so WACE and Rorschach and MMPI and TAT. But the goal is not only to arrive at standardized information that allows us to make diagnoses and plan treatment, et cetera, but also to use our tests to help clients make changes in the way they view themselves in the world that will be useful to them in pursuing their life goals. And so what we found is just by altering the procedures of traditional assessment a little bit, then the clients, the patients themselves feel like they learn a lot and are changed by the process. And so even if your report gets thrown in a wastebasket and never used again, somebody walks away um, with something that's been very useful to them. So that's sort of the schema.
Yeah.
And I happened upon this um, um, by uh, doing traditional assessment and particularly Rorschach and performance-based personality tests. And these ama clients had these amazing transformations as I was doing the assessment. And so then I got very curious about what makes that happen and what do we have to do to make it happen more frequently. And so that's how we developed therapeutic assessments. So,
Mhm, mhm. At what point in your
so
career,
that's the short story.
yes, at what point in your career did this happen that you came across the new way of doing things?
Right at the beginning, it's really funny.
Oh.
I was on my first practicum placement in graduate school, and I gave the Rorschach to this man in a psychiatric hospital that I was assigned to work with. And he was a well-known patient in the hospital, a schizophrenic guy named Joe. And Joe would show up in the psychiatric hospital twice a year, almost like on the date, into the emergency room psychotic. They would put him in the inpatient, stabilize him, and then send him out again. He would never do the outpatient treatment that was prescribed. And then 6 months later, he'd end up and they would stabilize him and send him out. So they sent me to do the Rorschach with him during I was a student. And so I was doing the Rorschach with him. And this amazing thing happened. It was like maybe one of my first patients ever to actually give the
Wow.
Rorschach to. And everything was going fine. And then I got to Ken, and he didn't see he refused to see anything in those cards. And he said, I can't see anything in those ugly cards. And here I am a student, and I thought, oh my God, I'm failing my first Rorschach. And I did oh, well, just take your time and you'll see something. And he wouldn't see anything. So finally, I packed up and went to my supervisor, and I felt so bad. Like, should I have been able to manage the situation?
Mhm.
And this really brilliant supervisor said, no, 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 you did fine. And what does it tell us that he wouldn't see any card? Oh, and he said, well, what do you know about the cards 8, 9, and 10? And I said, well, I think they bring up emotions, right? And he said, yes, very good.
Mhm.
So this is an in action of the defense mechanism of denial. And I said, oh, I see. And they said, here's what we know. We know Joe has had this terrible trauma in his life that he's never dealt with. He
Mhm.
won't talk about it when he's here. He won't go to outpatient therapy and deal with it. He just packs it away and refuses to look at it.
Mhm.
And then it causes him problems. And then it gets triggered again. And then he's back here. And so he really needs to like confront this stuff. And I said, oh, it makes so much sense. And I said, what do I do now? And they said, well, you go talk to Joe about this. And so I gave him feedback on his rhetoric, and I said, Joe, we think, remember those cards, and you wouldn't see anything, and then those cards we know stir up emotions, and it looks like there's a bunch of emotions that you haven't had enough support to face down and deal with. And, this is part of what is the problem. And, I imagine it's terrible things that you don't want to talk about, but if you could do that, it would really, really help you. And he was stunned,
Mhm.
just stunned. Said, this makes so much sense. And I said, if you'd go to these outpatient programs, then maybe it could help you a lot. So then, 6 months after the assessment, Joe didn't show up in the hospital, and everybody was worried about him.
Mhm.
And because they normally, I thought, oh my God, I hope nothing's terrible. Later, he comes to the emergency room, and I'm still in the hospital on a different practicum, and I get a message that Joe's in the inpatient ward and wants to see me. And I go, oh, I'm so glad to see you. Could we do those zinc plots again? It's the best thing that ever happened to me here. So,
Interesting. So that's how you started thinking that there's therapy in
and
assessment.
exactly, I went back to my professors at the university and I said, does anybody ever talk as like a therapeutic thing? And they said, no, not that we think of. And so I started right then
Mhm.
thinking this can happen with our tests, and how do we make it happen more often?
Mhm.
So,
Mhm. Mhm. Uh, how did you come to develop the
so I got my PhD and went to the university.
Yeah, continue, please.
Yeah, well, I got my PhD. I went to the university and I started doing research on what can you do to make assessment therapeutic.
Uh-huh.
First, I was focused on just how to give feedback so it's most helpful to people. We did a lot of research on that and we learned a lot of things.
Mhm.
Then I learned if you can do something at the beginning of the assessment, it helps you with the feedback.
Mhm.
And so we developed this technique of having clients form assessment questions at the beginning. We ask the client, what is it you want to learn about yourself? What puzzles you?
Yeah.
Where do you feel stuck? And can we use that to help you with the assessment? And then that helped a lot and things started happening. And then we looked at what you can do in the middle of the assessment
Mhm.
when you give tests to make them become therapeutic. And we developed a bunch of techniques there. And then when you put the whole package together, it turns out it's pretty reliably powerful.
Mhm.
And then we started expanding it to child assessments, adolescent assessments, couples assessments, and tweaking the procedure. Um, and we did research on it. Now there's over 40 or 50 studies
Mhm.
on therapeutic assessment assessment can be therapeutic and what it can help change. Um,
Very nice.
and so we've
What?
just gotten better at it over the
Yeah, yeah.
40 plus years that I've been doing it now. So
You said that there is a slight alteration of administration. Is it that the basic administration of the method stays the same and the context changes, or what is different about regular assessment?
thank you. Yeah. What we've changed, we give tests exactly by the standardized procedures so you can score them and use the norms, etc. So if you watch me give the Rorschach, it looks very much like you giving the Rorschach. So
Mhm.
anybody who's learned the standardized procedure. What we change is at the beginning, we tell the client, I'm giving this test because I think it will help answer your question X.
Mhm.
So that's a slight moderate
Mhm.
alteration. And I think what I've learned is if the client is invested in getting that answer through the testing, they proceed to give you the material you're going to need to
Mhm.
answer that question.
Mhm.
And so that changes a little bit. And we have some research, for example, if you get questions at the MMPI, the defensiveness scales on the MMPI are lower than if you don't get a question.
Mhm. Mhm. So you're
So,
involving other methods as
and then
well.
the other thing we do is after we give the standardized administration, we pull, we involve other methods as well. We put them all together. And then after we give the Rorschach, for example, we pull our chair around and we say, so what was that like for you? And then we talk about the experience with the client and perhaps some of their responses
Mhm.
using scaffolding to help them get insights into themselves.
Mhm.
And we try to connect what happened during the test to what happens in their life and what happens that's related to their assessment question. And by hooking those three things together, clients have incredible insights. So,
Mhm.
um, example, uh, we're blipping out a lot. Are you still getting me? Or do you
I'm
losing me
getting
at
you.
times?
It's
Or
glitching a bit, but it's good enough. So
it's okay. Okay, good. Yeah. So a man came an assessment and his main question was, I know I don't get close to my emotions. Why? And what would happen if I did? And I gave him the rush and um, I noticed some traumatic contents in his responses. And then when we got to cards 8, 9, 10, he'd been giving me 2, 3 responses to cards 1 through 7. We got to cards 8, 9, 10, and he only gave me one response on
mhm.
each of the cards. And so, and I noted this. And so I pulled my chair and I said, so what was that like for you? And he said, oh, it was okay. He said, I didn't like those last 3 cards, but the rest of it was fine. And I said, yeah, I noticed. What didn't you like about those cards? And he said, I don't know, something about emotion. And, remember I told you I don't do emotions.
Mhm.
And I said, yeah, I remember your question about, that you don't have much contact with your emotions, what would happen if? And he's interesting because what we know about these last 3 cards, we think is that they stir up emotion, and you only gave one response to each card. He said, oh, yeah. And I said, so it looked like you didn't want to sit with those cards and look at them more. Oh, um, and then I said, so can we try a little experiment? Would you be willing? And he said, sure, what? And I said, well, you wanted to know what would happen if you don't escape from emotions. Let
Mhm.
me give you those cards back and give me more responses to them. Would you be willing to do that? And so I handed him card 8, and he gave me 2 of the most traumatic contents seen. Card 9, same thing, and card 10, all these morbid, aggressive, responses. And, you know, And then I said, so how do you feel? It's so awful. I don't like that stuff. And I said, look what came through when you stayed. And I said, so, and do these responses remind you of anything from your life? And then he said, oh, yeah, I didn't tell you, but I actually had a terrible childhood.
Mhm.
But I've just been able to put it aside and go ahead.
Mhm.
And so then we sat and I said, so card eight, here's these two creatures fighting and they're trying to rip something apart and there's blood down here. What does it remind you of? And he said, oh, my parents used to have these wars when I was growing up and I would go in my room and just close the door and try not to think about it.
Mhm.
Oh, I said. So we started getting into the traumatic material that he had dissociated. And it ended up being so helpful.
Would you follow up therapeutically on an event like that in assessment?
We what we find is many people end an assessment and are quite eager to go into therapy and do more work,
Mhm.
and they arrive in therapy with clear goals and ready to work.
Yeah.
So therapists tell us, "Oh, this client is so ripe for therapy now. Thank you."
Mhm.
Some people decide to just take what they learn and go away and work on it. And when we do follow-up sessions, some people are capable of continuing to integrate and work on the assessment themselves and get a lot of benefit from
Mhm.
this.
Mhm. When,
And people will come for an assessment who would never set foot in the door for therapy because they're afraid of therapy.
of course, yeah.
And then sometimes after an assessment, they're quite open and eager. So
So do they know they're coming for therapeutic assessment then?
yeah, I explained at the beginning.
Uh-huh.
And so of course we're famous now, so people come just for
Yes,
it
yes.
sometimes. But sometimes I just say, you're coming for this, but I think it's helpful sometimes to do an assessment. Would you be willing and interested? Oh, yes. And so then I explain the procedure, and then they decide whether or not they want to do it. So,
Yeah, yeah, yeah. When we were in Spain, you spoke about a client with whom you worked on actual reworking of memories through your
yeah,
contact. Could you explain that concept, how that could happen within the framework of the assessment?
sure. So there's a bunch of new research on a feature called memory reconsolidation. And there are a bunch of new therapies that have been developed to try to work on this. And the idea behind memory reconsolidation is that symptoms are generated by implicit emotional schemas that were useful to the person years ago in their traumatic context. Like you may come to believe, so maybe your problem is never succeeding in life, although you're pretty smart and whatever. And you may discover through these various therapies or through therapeutic assessment that you early on developed a schema. I should not be successful because if I do, my father will slam me down because he's threatened by my being successful because of his own low self-esteem. So if we can conduct an assessment in such a way that this comes to light, and then we can conduct an assessment in a way that the client has an experience that contradicts the deep emotional schema, that there can be a therapeutic change in the self narrative that then carries the person forward. And our tests are very good at unearthing these unconscious schemas, especially our tests like the Rorschach or the, TAT or those kinds of things. And so you can actually, it seems like, change somebody's core pathological narrative
Mhm.
through psychological assessment, and then you send them out into the world and they go ahead in a new way. So
Mhm. But how does the reworking happen then? Because the tests evoke the schemas.
yeah.
How do they get reintegrated within the assessment time or therapeutic assessment procedure?
Yeah. Um, we arrange with the basis of what we know from the standardized testing, we arrange test-based situations that will contradict the client's schema. So another case that I show a lot, young man comes, he's 26 years old, still living with parents, not succeeding. and he had a verbal learning disability and a very critical father who, quote unquote, tutored him for hours after school, screaming at him because he couldn't read and whatever. The mother told me she would go in her room and put a pillow over her head not to watch it. I give him the waist and I find out he still has a verbal learning disability, but he has 130 performance IQ and a perfect score on block design.
Wow.
And yeah, when I do block design and I ask him afterwards, how did he think he did? He told me, oh, he didn't do very well and whatever, you know. So the negative
Wow. Yes.
self-view is so then during the assessment, I decided to give him the Bender Gestalt test.
Mhm.
Do you all know that test and use it? You copy
I don't
geometrically?
use it, but I know about it.
Yeah. So I give him the test and then I ask him to do an immediate recall. He does the test perfectly as I predicted from his waist performance,
Mhm.
and he remembers 8 out of 9 of the figures perfectly. I
Mhm.
asked him afterwards how he did. Oh, I did terribly. He said, I think I didn't do well. I think I forgot a bunch of them. The cognitive distortion
Yes.
from the pathogenic belief. Then I turn over the paper and I go, actually, you did way above average. You remembered 8 out of the 9. Most people only remember 6. They're perfectly drawn. This is a perfect performance. And he went into shock.
Mhm.
And he said, nobody's ever given me feedback that I did anything well.
Mhm.
And I said, well, here it is. You have this amazing ability. And it turned out he did have one area of his life that he thought he was capable in, which is music,
Okay.
but it didn't count for his family. They wanted him to be in academics, you know.
Mhm.
And after the assessment, this impact that he was probably able to do things, but nobody recognized it. He became a successful musician and has a band that's internationally famous now. So I arranged an experience where he got information that was contradicting this negative core belief about himself. And it changed his view of himself in such a way that then new doors opened up for him.
Yes, yes. I even remember a case of a client where you actually to me, it seemed like a Gestalt way of doing it.
Yeah.
You had the client identify with some content in his response and
Yeah,
follow it up on that. It was,
exactly.
yeah.
Yeah. Yeah, so in when we pull our chair around and talk about the
Uh-huh.
testing, sometimes clients can help us see content associations that then open up old traumas, which then can be discussed and resolved. And they've never been discussed before because they were dissociated. We know our projective tests, our performance-based tests tap areas of the brain related to old traumas and memories.
Mhm.
And so if you bring them out and talk about them, they can begin to be resolved.
Yeah,
So,
yeah, yeah.
yeah, Fonagy has this idea that I think is very important. A trauma is not a hard event. A trauma is a hard event that has not been able to be processed with
Yes.
support of others. And so if we can get these old things opened up, then we can process them with the client and it frees them in ways that they've not been able to be freed before.
Yeah, yeah. And I saw an example of your couples work because you showed us couples therapy. It was collaborative couples assessment with Rorschach.
Yeah. Yeah.
And that was very insightful to me how you spoke about that you as a therapist either become the safe person for the person that is in this traumatic event rememorization, or when it's in a couple context you can facilitate that the other person in the couple is there supported by you to be the safe person to support his or her spouse.
Exactly. We teach them how to be better attachment figures to each other,
Yes. Yes.
helping to process difficult events and emotions, which actually brings them closer and develops more empathy for each other. Oh, my wife does this not because she's a bitch, but she does this because there's some old trauma that keeps getting triggered when I do X. Oh, okay. So I can either change my behavior or I can be empathic to my wife about how she experiences that. And it brings couples closer together. So.
Yeah. Seeing that, well, you played as a video was very touching, and also it was a collaborative assessment.
Yeah.
Not many people in our context know about collaborative Rorschach or even collaborative sequence analysis. Could you
Yeah.
elaborate on that?
Yeah, exactly. So again, our goal is this idea that there's information from our test that we could tell clients that would be very useful to them. But what our research shows is if the feedback you want to give a client from a test is too discrepant from their usual ways of thinking about themselves, they'll reject the feedback because they're trying to maintain their coherent sense of self and they have a different way of thinking about themselves. And or if they took in the information you're giving them, it would arouse emotions that they can't handle. So they stay with their old story about themselves rather than taking in the new story. And what our research shows, if you want to help somebody develop a new way of viewing themselves, you can't just hand them a new narrative on a plate at the end of the assessment. They won't take it in. But if you can work slowly, scaffolding with half steps, new insights about themselves, and processing the emotions as the narrative changes slightly, then at the end of the assessment, they have taken it in.
Mhm.
And our tests are very good at identifying information that, again, that would be useful, but the client can't take it in because it's too discrepant. And then you can use the testing with these little half steps,
Mhm.
and the client themselves develop the new narrative. They co-edit the narrative with you as you go along, with you leading the way,
Mhm.
just a half a step ahead of them. And then they can make these huge shifts in how they view themselves in the world that would normally you couldn't give just by giving feedback at tests. So yeah.
Yes, yes, yes.
I mean, an example would be in our child assessments, parents come saying, we think our son has ADD, and then you test the child, and the child has attention and concentration problems, but they're not based in ADD. They're based in anxiety, depression, and attachment failures. I mean, if we tried years ago, you just, oh, thank you. We've tested little, Marek, and the good news is he doesn't have ADD. The bad news is that he's depressed and anxious and whatever. Parents will walk out of the office, say no fucking way. But if in our child assessments, parents watch the testing
Mhm.
with, if possible, someone sitting them, helping them notice what's going on. And by the end of the assessment, they themselves see, the kid is taking a Rorschach and seeing all these morbid responses. And the father turns to you and goes, he sees a lot of dead and damaged things. Is that normal? And you say, well, most kids his age usually only see one or two, and we're already at 9. What might that mean? And the father goes, oh, gee, I wonder if he might feel dead or damaged somehow. Oh, you go, brilliant. That's how we might think too. Anything we can think of that might have get him feeling that way. Oh, well, when he was 2 and 3 and 4, his mother and I were in World War III. And
Yeah.
so, and they'll take in the information where normally they would not take it in.
Mm-hmm, mm-hmm. Interesting. So this is how the content and interpretation can become collaborative. Like you look back into what was happening during the tests and kind of invites the client to interpret together.
Yeah, yeah. And it can either be content or it could be the comportment during the testing.
Yes, yes.
I think I might have told about um, this guy he was in problems at work. People said he was very disdainful as a boss of his group.
Mhm.
And his Rorschach showed a lot of shame, but narcissistic defenses against a lot of grandiosity. He would have all these terrible Rorschach responses, but then he would see crowns and, performers being, all this narcissistic content, reflection responses. And so after I did the Rorschach, I was able to look at it with him, and he was able to understand that actually he had some very vulnerable feelings. And when those get triggered, if he felt helpless or on the spot, then he would go into this I'm king of the world place, And it didn't work too well with his employees. And he was able to see that dynamic himself. And and it happened in the process also, not just the content. When I was giving the Rorschach, I think he felt insecure because he didn't know what the right responses were. And he started being quite demeaning of me in the session. So so afterwards, I was able to say, so how would you describe how you interacted with me during the test? And he said, oh, I wouldn't have said. And I said, well, when you said this, this, and this, don't you think that could be a little offensive? And one point, I'm giving the Rorschach, and he said, oh, this test is a piece of crap. I feel bad for you if this is what you do all day.
How did he react?
Well, then when I said, this way you were with me, don't you think it could be a little offensive? And he goes, oh, this is what my employees say that I do.
Uh-huh. So he kept.
And then I said, this was a terrible test for you because you didn't know the right answer and you felt vulnerable, right? And look how you treated me when that was going on. And it really made sense to him and he could take it in.
Do you think that working this way, when you reflect a lot on what was actually happening and what answers the person gave in projectives, for example, that it somehow makes it more difficult for the person to be tested again?
It could happen. So if you knew for sure the person was going to get tested again, you might be a little more circumspect, I think. But most of the clients I see are not going to be tested again.
Yeah.
And a student did a dissertation doing the Rorschach, doing extended inquiry versus another group of people who took the Rorschach and had a little intellectual lecture about the Rorschach afterwards. And the retest coefficients were not much different for the people. So yeah.
I would expect.
Or if they give a different Rorschach, it's because I think they've changed,
Yeah.
So
Two questions come to mind. One of them, you just used the phrase extended inquiry.
yeah.
So could you elaborate on that? And the other one was using Rorschach in couples assessment or couples process somehow, because I know you do that as well. So
Yeah.
could you elaborate on these two things?
Sure. Extended inquiry was this term invented by Leonard Handler, who was one of the pioneers of collaborative assessment, which is after you give a test by the Standards Administration, asking the client what they noticed and sharing what you noticed and beginning to analyze it together, get collaborative interpretations of it. So, and we do it after a WACE, we do it after a Rorschach. An extended inquiry of a self-report test might be discussing some of the critical items on the MMPI,
Yep.
Yeah, we just have found it so helpful. Again, if you're working in a forensic context, you might have to be careful, or if you know the client's going to be retested or something. But in most of the settings we work, it's really just about helping the client therapeutically. So it works very well.
Yeah.
And then Rorschach.
Collaborate couples Rorschach.
Couples assessment. In couples assessments, very often we have people form questions about themselves and the relationship at the beginning. We separate them and we give them, and so we use the Rorschach individually with them to understand who they are. And then very frequently in couples, we use a procedure that actually goes all the way back to Walter Klopfer and other people called the consensus Rorschach.
Okay.
And you can do it with couples, you can do it with families, you can do it with working groups. I've done it with a group of private practice psychologists who are in conflict with each other. And what you do is you give the Rorschach plots and you say, we want you to come up with responses both of you can agree upon and see, and then tell me and talk out loud while you reach those consensus responses. And you get very interesting thing happens. The couple often replays the dysfunctional dance they do at home that's related to their problems, because there are these projective identification splits in couples where one holds one side of things and one, so a woman who's depressed when you give the consensus Rorschach is seeing all kinds of morbid responses, etc., and her husband suggesting butterflies and rainbows. And then at the end, you say, gosh, that was very interesting. What happened? Does that remind you of anything in your couple relationship? And he says, yes, she's always dark and gloomy, and I'm always trying to cheer her up. And she says, yeah, and every time you try to cheer me up, it just makes me feel more dark and gloomy. You know? So you get this chance to work with the test, with this pattern that happens in the couple. And you might teach them a new way to arrive at consensus responses that then might have
So
an
it doesn't
impact.
stay in like, I see it this way, you see it that way. They still have the task of finding a common answer.
Yeah.
Okay, that might
Yeah.
be challenging.
Yeah. And sometimes you get a thing where they've each done their individual Rorschach, so you know what they saw individually. When they come together as a couple, only the husband's responses make it into the consensus protocol because he dominates the wife.
Yeah.
Or um, the wife has good form quality responses in her individual Rorschach, but she accepts all the minus form quality responses from
Yes.
her husband. You know, it's rich to be able to talk about this stuff. Yeah.
One controversial thing, at least in our context, it's a question of controversy, and that is assessing your own therapy clients. I don't know how about in the States, but here the tradition was that you never assess the client you're going to have for therapy. What you're doing is therapeutic assessment, which is both at the same time, but it's time limited. But what do you think about doing assessment on one's own clients at the beginning or throughout the process of therapy?
Yeah, we found if you do it at the beginning and then see the client in therapy, it's very useful and you can keep metabolizing the results of the assessment. And, you know, um, I work in my therapeutic style is more modern, analytic, interpersonal, intersubjectivity, that kind of thing. So I'm not trying to be a blank screen. So it just is very helpful, and the therapy continues with a very similar feel to it. So if I also will sometimes administer one or two tests to my own clients in the middle of therapy. And there are reasons to be concerned. So we have research, for example, that if you give the Rorschach to your own client that you've been working with, there are more sex responses, there are more traumatic contents,
More
etc.
regressed, isn't it?
Yeah, the client regresses a little bit more. Um, but and so you'd have to be more cautious about it. If you get more form quality minus responses, that's typical, right? But we know from Exner's work with the Rorschach, it doesn't necessarily raise the thought disorder indices, you know, the WSM6 or those kinds of things, testing your own clients. So if you get a bunch of that stuff coming through, then you might pay attention to it. But again, we found if there's the client and you have been puzzling again and again about why the hell do I keep doing this thing that we've worked on a million times, I say, well, maybe a test would help, and we give the Rorschach. And as long as you're cautious about interpreting some of the standardized indices, it can open up a world for you and your client.
So you're not against using using assessment during the
As
process.
long as you do it thoughtfully, as long as you do it thoughtfully. There are good reasons why those rules were in place, but you can, I think, be thoughtful about it. So
Yes.
and still do it. So yeah.
Thank you. Maybe
Yeah.
one of the last questions, the feedback, the feedback and report writing. Is also the way you write reports different? Because in our context, most of the people in clinical psychology would write reports for psychiatrists.
Yeah.
Sometimes we wonder about what happens when the client sees it, and things like that. How do you deal with this dilemma?
If we need to write a report for a hospital or a psychiatrist or another therapist, we write it in language that the client can understand. And we even may share it with the client beforehand and get them to comment on it, for example. And Constance Fisher, another one of the pioneers of collaborative assessment, developed this technique where the client would write comments about the report. And so you'd get these very interesting things. There would be the letter to the psychiatrist, and then the client would say, everything Dr. Fisher said about me is true, except for the fact about me being paranoid. That is absolutely not true. The FBI really is out to get me. And then that gets appended to the report and sent to
Okay.
the psychiatrist and anybody else who sees it. And it's very useful to be able to see where the client is, you know? So,
That's interesting.
so, but in our context where clients are coming not, they're coming for therapeutic purposes, we tend to write letters to clients at the end of the assessment, answering their questions for the assessment in plain language based on the discussions we've had before. And then we share that letter with the treatment team or the therapist.
Mhm.
And it's, you know, I don't do a lot of forensic work, but even the few times I've tried to write user-friendly reports that are going to go to a judge, the judge just told me it's the most useful document he's ever seen on the basis of any psychological assessment
Mhm.
because he can understand it, you know.
Oh, okay.
Yeah.
Because I remember from your book, and I haven't looked into it for some time, but
Yeah.
the feedback, it was either a letter or some kind of
Yeah.
resume. It was very personal, and it was not in generalizations about like this is a schizoid person and that's it, but it was more about witnessing to the meeting with the person and to the
Yeah.
dynamics that was
And
present.
we've done research on this. So if you give oral feedback at the end of an assessment
Mhm.
and write one of these user-friendly letters or reports, the therapeutic effects are 1 + 1 = 3.
Okay.
Oral feedback alone will be useful.
Mhm.
Written feedback alone is useful if it's client-centered. Put the two together and it enhances the therapeutic
Mhm.
effect.
Mhm.
And clients come a year later to want to talk to you, and they pull out from their knapsack a folded, creased, dirty letter that they've read 1,000 times
Mhm.
and tell you how meaningful it was and how they showed it to this person and that helped them, whatever. So
Mhm.
these can be really important therapeutic tools.
Mhm. Interesting. Do you think that I understand that you would probably say that there are many aspects of therapeutic assessment that can be used within the context that is not therapeutic assessment per se. Uh,
Exactly. We encourage people to just take whatever piece you can use in your own context and that you feel ready for and start using it and see what happens. It might be you do nothing else but ask a client at the
yeah,
beginning what
yeah.
questions they
Well, I
have
started
about the
doing it
thing.
almost at the beginning of my practice.
Yeah,
I first came across your work partially. Partially,
yeah,
I was motivated by some other resources because I was teaching on inner and external motivation. Uh,
yeah.
and I was eager to enhance the intrinsic motivation, you know. And then I
And what
found,
did you experience when you started asking clients for questions? How did it
well,
change your
it was more
practice?
meaningful for me. I was
Yeah.
also less kind of worried about the feedback I would give to the patients because I could build it around what the person wanted.
And
Uh,
did it change the experience for the client?
I think so. I think
Yeah,
so. I think so. I do not have the comparison because I've almost always been doing it like that.
yeah.
Except for some at psychiatry ward, some clients who would just not cooperative at all. But
Yeah.
generally, it very much put different vibes into the whole experience. And then I was so happy to find it in your book because it was very much to the point. Plus, it was way more elaborated and based and research based. So yeah.
And Mark, are you familiar with Fonagy's work on epistemic trust? Do you know about that?
I've heard the word from you for the first time a few months ago.
Okay.
Can you
Yeah.
elaborate just in the final few minutes?
Yeah, Fonagy has written a number of papers that are really fascinating about how particularly personality disordered and paranoid clients, because of hurtful attachment experiences growing up, became very skeptical about taking in information from people. Or if they decide to trust someone, they do it on the basis of characteristics of the person that are not indicative of trustworthiness, like they're the same race as me, or they're the same religion as me, or you know, whatever. And so what he says is the difficulty in therapy with many of these patients is getting them to take in information from you because the guard is up. And there are a number of things you can do as a clinician that allow the person to start taking in information and believing you. And what you have to do is convince the client that their personal best interests are at the core of your intervention. You're not working with them so you can feel effective. You're not working with them because you get narcissistic pleasure out of this, that, whatever. You're working with them because you want to help them with what's important to them. And so we think assessment questions create a context where clients begin to feel at the center of things, that it allows them to take in information that otherwise they might not take in.
And also they have a reason to cooperate once they have their own questions that they come with. I oftentimes tell the client, look, this is what the doctor needs and what the hospital needs for this and that reason, but you're now here with me, and I would like to know what you want to find out, what you want to do.
I'm delighted these ideas have been useful and that you've been implementing them. How great.
So I would love younger. I've told just today in some supervision to younger colleagues, if I was at the beginning of my career, and I do more supervision than assessment practically these days and teach. If I was at the beginning, I would look carefully at therapeutic assessment, and that's the way I would go, because that makes sense and makes things way more tangible, way more humane, and just to the point, So yeah, it makes us
great. I mean, the other useful tip I can give people that's so fundamental, but if you give feedback to clients, what our research showed is the very first thing you should tell people in a feedback session is something they already know about themselves. Yes. Then information that's a little bit discrepant, but not too disorganizing or anxiety provoking. And if in that order, and then you give the information that's a little more touchy, clients are more likely to take it in.
Yeah. It's incremental. So, okay, Steve, it's going to be 1 hour, almost 1 hour since we started. So we would end here. Thank you very much for your time.
Thank you for this opportunity. Yeah, your questions were so great. So I hope I was able to give people a taste of what we do. So.
I was so happy to have
okay.
And we might find a way to follow up. We talked about some possibilities, so we'll
I'd love to show some videotapes to people in Czech as well.
It would be nice
Czech Republic,
where people would be able to witness your work and maybe follow up on that. So thank you very much. We'll keep in touch.
Great. Thank you. And hi to all the Czech psychologists there. So, okay. Bye-bye.
Bye-bye. Thank you.